All right, guys, it's time for another episode. That means pre-cals. So what's going on?
We have Dr. Maria Sokolina. She is a sleep dentist from Clifton, New Jersey, joining us today. We've met Dr. Sokolina at some of the different meetings, and actually,
Yeah,
we've been on her podcast
that's right. Right.
last year. And so she offered to come on ours, and we were so glad to have her. So we're looking forward to hearing her talk about oral appliance therapy and maybe some other things. I think she's got some other things up her sleeve she wants to talk to us about today on the podcast.
Yeah, I think she's got some things related to myofunctional therapy that she wants to cover, and some of our audience may not even know what that is. So it'll be interesting for them to be able to, hear a little bit about that and how that's working from a strategy standpoint in her practice.
That sounds very interesting. That being a dentist and doing myofunctional therapy, that definitely sounds interesting.
Absolutely,
Yeah. All right. With that being said, you guys ready?
let's do it.
Let's do it.
Lights out.
Now, a word from our sponsor, Medbridge Healthcare. Medbridge Healthcare is a leading provider of sleep lab management services and home sleep apnea testing. Medbridge partners with hospitals, healthcare systems, and medical academic institutions to offer comprehensive, fully integrated services for sleep
So good to
disorders.
see everyone this morning. We've got a great guest with us today. We have Dr. Maria Sokolina of Harmony Dental Arts of Clifton, New Jersey, serving both New Jersey and New York. Dr. Sokolina is board certified dentist by the American Academy of Dental Sleep Medicine. She has successfully placed and repaired hundreds of dental implants, helping her patients achieve their goals with restorative and cosmetic dentistry. As one of the leading dentists in New Jersey, Dr. Sokolina has earned esteemed recognition due to her mastery of orthodontics. Furthermore, Dr. Sokolina strives to expand her knowledge through ongoing studies of innovative techniques, including myofunctional therapy. Awarded a top dentist rating by Healthy Living magazine and selected as the best dentist of 2015 and 2017 by a panel of her peers. In 1998, Dr. Sokolina graduated from NYU Dental School with honors. Additionally, she was awarded the Periodontics Honor Award and continued her postgraduate training at Newark's Beth Israel Medical Center, one of the most prestigious dental schools in the country. After completing her postgraduate training, Dr. Sokolina was a lecturer at the Dental Convention in Atlantic City in 2001, where she presented a lecture on treatment techniques in pediatric dentistry and published an article in the World Journal of Orthodontics in 2002. In 2003, Dr. Sokolina completed a mini residency program on oral implants, after which she moved on to completing courses from renowned institutions like Dawson Academy, USDI Institute for Orthodontic Training, and Tufts University for Sleep Apnea. Dr. Sokolina, thank you for joining us today. It's such a pleasure to have you on. We usually get to see you at the different meetings that we interact with you around the country. So it's a pleasure to have you today. One of the questions we love to ask everyone is how did they get into sleep, and in your case, sleep dentistry? After working so much with oral implants and things like that, what drew you to sleep? What was the draw there for you?
That was, I would say, story out of fear. I would put it that way. When I finished my residency, just like you mentioned in my bio, I was looking for my pathway in dentistry, and I'm very aesthetic person. I really like to create beautiful things. And that idea, what somebody gonna break my work with a strong clenching or grinding, would put me into the sleepless nights. Like I was thinking, what can I do to ensure that nobody can break my work? So I did, just like you mentioned in my bio, I did a lot of cosmetic courses. I want to learn how to use the strongest materials, what people cannot grind them away, but they still did. And then I thought, I'm going to position teeth in a right way. It's going to be such a beautiful smile. It is going to be right scheme long lines in the front and just dots in the back. That's what they taught me in the Dawson Academy. And I thought that's going to be an undestructible model. No, it did not. And then during my orthodontic residency, I learned what sleep. If they not going to sleep in a healthy way, then they can do anything and everything possible. And yes, from my practical stories, I agree with that topic. And that's how I got into sleep, into the Taft, sleep residency. And then I start learning more and more. Of course, what you learn from books not going to be the same what you're going to learn from the field. And that the field was very exciting. And actually in the field there, I met a lot of sleep technicians who taught me a lot of important secrets about the sleep.
Fantastic. And I know that you have honed your skills and really have become an expert in this world of myofunctional oral appliance therapy for CPAP patients, or for sleep apnea patients, I should say. Can you tell us a little bit about the technology, and that particular part of the field that your expertise is in?
Yeah, that was also, I would say, maybe not the fear would be the right emotion, but my desire to help my patients better and also impress the referring sleep physicians. Yes, I start doing just like, a lot of dentists who learn about sleep with oral appliance therapy. I do a lot of different designs of oral appliance. I have this one, and I do really thin one out of nylon, which like a clear liners. But you can put the most beautiful appliance in the mouth. But if patient cannot breathe through the nose, or at least have intention to breathe through the nose, and that appliance not gonna work so well. Patient gonna open the mouth and they're gonna go into apneic event just like without appliance. And yes, I did oral appliance therapy as is, and letters from the physician would come back and said, you need to do something else. The results of your treatment unsatisfactory. That was really painful. That hurt me so much. So I was looking for different adjunct therapies. I was, helping people to open the nose with, different irrigation solution. We talk about tapes, and we talk about mute to open the nose while they sleep. And, I talk about a different, this is the breathing, the breathing exercise tool. So I use a lot of tools until also from some of the courses, I learned what myofunctional therapy exists. And that type of therapy, where we work on the 4 different components. We teach patients how to breathe through the nose. We teach patients how to hold the lips together. And it's very important for CPAP users. If you cannot breathe through the nose and you open your mouth, then path to success gonna be the full mask. Not everyone wants to have a full mask, but it's very important from the start to understand that idea. But during the lifetime, if a person does not breathe through the nose, the lips become kind of weak. They have a different mechanism. They don't hold. They don't stay together. So that's very important, breathing through the nose and keeping the lips together. And now we're going to most important component of airway called tongue. And this actually, driving force of the airway. If tongue through the mouth breathing stay on the floor of the mouth, then at night it's just gonna fall back and close the airway, maybe completely, maybe partially, and airway gonna become really, maybe partially, and it's gonna become small, and the air gonna turbinate, turbination of air in the airway that's produce snoring, and eventually it collapses. So myofunctional therapy work on 4 components: breathing through the nose, holding the lips together, holding the tongue on the roof of the mouth, and tongue have to be strong enough but it stay on a palate through the night, hopefully, and through the day, and support swallowing, swallowing of the water, swallowing of the food. But you need to have a certain muscle mass. It has to be toned in a proper way to be able to do so. So that's what we explain to our patients. We explain them the exercise, we give them the homework. It's actually the lengthy process between 6 to 8 months, and then follow up afterwards. So it's a whole lifetime project. We're trying to make patients involved to become healthier. So that's the myofunctional therapy.
So that's, that's a really great explanation of it, because, what you kind of outlined is this isn't a quick fix. This takes some dedication and determination. What drew you to myofunctional therapy? For a lot of people, it's kind of a new topic, because we tend to just go straight to, the different devices, whether it's an oral appliance or a CPAP or something else. But what drew you to really investigate and become a specialist in myofunctional therapy?
Originally, when I graduated from my medical school in Russia, I want to cure my patients, not to give them something what they have to be bound for the rest of their life. I want to find a solution what can provide long-term benefits, or hopefully lifetime benefits. And a lot of, then I start practicing, and, I love what I do. I find inspiration in every single patient story, and I do a lot of observations, and I notice that was strange. Why people who, and I see the signs of sleep apnea in the mouth, the grinding and the thorax and, crowded airway, enlarged uvula, why they also, a lot of them grind the teeth, and they have a crowding also. And I was, why is that? Like, oh, genetic, we like to give that, oh, genetic, that's your genetic. But then I look at the habits, and I notice what they all have the same habits, if we can call it mouth breathing as a habit. So they all breathe through the mouth. Okay, so that's one of the things. Then I asked a lot of people, they talking to me, and I asked them, how you breathe, through the mouth or through the nose? And they said, I'm not so sure, but I keep the glass of water next to the bed. So, and during our conversation, I see the lips apart. They have the lips apart, but they don't know that. So, it's another awareness. And then I also asked the people, oh, how do you hold your tongue? Or people said, oh, I never even thought about that, where I hold my tongue. What are you talking about? Tongue is tongue. Tongue is inside the mouth. That's enough. So, and then I noticed those people who I just described very often come to my office, and they said, I have a terrible headache. I cannot open my mouth. My jaw joint hurts terribly. I cannot chew the food. Do something. And I connect those dots. And now, when I have the knowledge of myofunctional therapy and become even better observer of the patient situation, I can give them valuable advice as a start, and then maybe explain them more if they want to gain the knowledge. That's how, if I would put all my long stories into the short sentence, I'm able to connect the dots and find routes to roots. With myofunctional therapy, I was able to explain temporomandibular joint puzzle. I was able to explain orthodontic relapse. Because nothing can be stronger than a muscle. You can do a lot of beautiful surgeries, but if muscle want to be there, that's it.
Are you a sleep tech looking for new opportunities? Well, Medbridge Healthcare is one of the largest employers of sleep technologists, and they are growing. If you are a sleep technologist interested in a new position, potential paid relocation, or looking for a career advancement, consider a career with Medbridge Healthcare. Now back to the show.
So, question for you. You mentioned sleep techs earlier and your involvement and engagement with sleep techs. Can you tell us sort of how would a sleep tech identify a patient maybe in their general everyday nighttime routine of doing CPAP titrations, where they might identify patients who might benefit from myofunctional therapy, and then how do you incorporate that into a plan of care for a patient as part of their ongoing CPAP, or their initial, I guess, and ongoing CPAP therapy?
This is like, I love this question. Number one, SleepTech, they actually my ambassadors. When, I was just so new and I had no clue, I spent a lot of nights in the sleep labs and talking to the SleepTech, what actually they do, how the sleep study happened. And what I realized, the SleepTech, they have most intimate relationship with the patient. They actually put patient to bed. We're talking about trust, we're talking about, relationship. What can be better relationship than that moment? Okay. And, what I learned from my nights in the sleep center, patient come, and they're going to have a sleep study. Number one, if SleepTech going to take a moment and look how patient breathe, or not even breathe, during the conversation, if patients sit like that. Okay. And maybe, I don't know if every SleepTech does that, but sometimes SleepTech keep the glass of water next to the bed, to make sure. And patient, use that glass of water through the night. So that have to, make them a good detective. What maybe nose breathing is not the forte in this particular case. Also, a lot of times, people have a conversation and they see the teeth. SleepTech are so close, they can see if teeth are grinded down. So that's another sign of bruxism. I'm not so sure or if SleepTech look at the mouth at all, but, those signs, probably not, but open mouth and signs of bruxism on the teeth can give some
I
clue.
think it's a great question. They probably don't do that. They probably do ask about teeth grinding and clenching that would open that. Two questions for you. One, kind of bringing me back to my time in the oral appliance industry a little over a year ago. But one of the things I don't think that we appreciate in the sleep medicine side is the value of nasal breathing. I think it's one of those things we just assume that, okay, we're going to fix the apnea, whether it's a full face mask or whatever. But I think, one of the things that I learned in my journey in dental sleep was there's a real value to that. Can you explain that, why nasal breathing is so important? And of course, as you think about myofunctional therapy and oral appliance therapy, that all plays into that space of promoting nasal breathing. But there's a physiologic response to that I think that our audience needs to know about.
Oh, that's a fantastic question. And if you see on my background, I have my social media channels where we constantly talk about importance of the nose breathing. I'm going to start a little bit far. So if we talk about sympathetic nervous system and parasympathetic nervous system, so breathing through the nose activate parasympathetic nervous system, which is really important for sleep. We want to be in a parasympathetic mode when we sleep. We don't want to be in a fight or flight response when we actually plan to slumber. And when we breathe through the mouth, center of a sympathetic nervous system in the chest. So we activate being constantly alert. We want to go to sleep, but we actually acting like we want to be alert. And a lot of people, they mouth breathe and they talk to me about racing thoughts. And it's a direct correlation between that stimulation and the racing thoughts. Actually, head is part of the body, brain is part of the body. We're stimulating those racing thoughts with the breathing through the mouth. Now we're talking about more in practical terms, an importance of nasal breathing. Breathing through the mouth increase the resistance, which, resistance of the air and eventually, lead to collapse. And there are a lot of scientific study. I write a lot of articles. I have a lot of publications. I always put those studies in a reference about connection between mouth breathing and sleep apnea. But through the practical standpoint, I would say 99% of my patients are mouth breathers. And yes, it would be a great help when education can start from a sleep test. If sleep technicians can be our collaborator and mention to the patient, we're going to start with the CPAP machine, and I see the signs of you breathing through the mouth. Maybe the full mask is really a good start for you to see the benefits. Because a lot of people want to have a nasal pillow. Of course, this is so much more comfortable to have a nasal pillow. But if patient has no clue how he or she breathing, and she's breathing through the mouth, nasal pillow gonna help this air to go from the nose to the mouth. And then pressure gonna be increased so much, and I don't know if it's gonna increase the comfort or get the results of the sleep study with the leak.
Well, with that, we're almost out of time, but do you have a quick kind of success story with this that you can share with us and our audience can take away as one of those stories you look back on as, inspiring for you as much as it is for your colleagues that you work with?
I would say I really love this story. I actually met this patient in pulmonologist office. I met this patient in pulmonologist office, and he was a really successful user of a CPAP machine. But he met me and he said, yes, I'm traveling a lot. CPAP machine is not such a, great traveling companion. I need to have oral appliance. He started using oral appliance and he loved it more. So, he said, this time I'm going to use oral appliance, not a CPAP machine. Okay, so several years passed by. He come back for reevaluation, said, I'm not using oral appliance. I got back to my CPAP machine. I said, great, life goes on, circumstances change. He's back on the CPAP machine. Great. So more time passed by, and he came back to me and said, I actually want a cure. I want you to find something because I don't want not oral appliance and not a CPAP machine. And at that time, it was the beginning of my myofunctional therapy journey, but this particular case really encouraged me. I offered him orthodontic therapy. We did clear aligners, but I can expand his mouth. And he was my most diligent student of myofunctional therapy. I taught him, and he actually practiced and did his homework on doing 4 things: breathing through the nose, holding the lips together, keeping the tongue on the roof of the mouth, and swallowing just with the tongue on the roof of the mouth. And I actually have his interview on my channel on the Facebook. And I cannot say his name, but if your audience would watch his interview, he is there. He's talking about switching to the different therapies. And his sleep doctor was really surprised when he got the sleep study without anything, and apnea was not there. When I think about that story, not every day goes smoothly, but when I think about that story, that was actually what I wanted to do when I finished my first medical school. I want to bring the cure to the patients, and it might not be forever. We need to check him every 5 years with a sleep study to make sure, sleep apnea is a progressive disease. But at this moment, I did what I really, I was able to accomplish to follow my mission to be a doctor. So that's the story. I hope it's encouraging for and sleep technicians. I want to mention that sleep technicians, you are the one who can be our ambassadors, who can educate the patients about different options. And for this time period, it can be that option. For that time period, it can be another option. And I write a lot about that in my articles on my website, drmariasokolina.com. I put all the articles where I put combination of different therapies in a different life period, and I hope it can be useful for your audience.
Fantastic. Thank you so much. You have been a joy to have on the show today. We've learned a lot about myofunctional therapy, and I hope that it will help our sleep techs to be able to consider, a little different assessment maybe on patients as they come into the sleep lab during the nighttime. And thank you for providing the contact information for your website. We love for our audience to be able to reach out and connect with you to learn more about what you do. And we appreciate your being here with us today.
Well, I appreciate you so much, and I always enjoy spending time with you on all these multiple conferences. Thank you.
Thank you.
All right, time for some post-cals.
Well, Jerry, that was really good. I mean, Dr. Sokolina, she delivered, I think what's most exciting talking to her is she's passionate.
Right.
When she's talking about myofunctional therapy, oral appliance therapy, she is truly trying to really take that patient to the next level, and her admitting some of the things that physicians came back to her with that she had to address for her patients is something you don't normally hear out of any doctor, that they needed to fix something. And she rose to the challenge. She began to look at what she could do to help the patient. And it was exciting hearing her go through that, explain myofunctional therapy. And I thought it was very educational and engaging. What did you think, Robert?
I think that it's interesting because I would love to see the plan of care that she has for her patients, because all of the different tools and things that she talked about, and even nasal airway patency, taking that into consideration before you do a titration. I have to confess, as a sleep tech, I don't think that I ever really considered, how well can my patient breathe through their nose before I started my CPAP titration. It was essentially, I'll just deal with whatever happens during the nighttime, whether it's a chin strap or a full face mask or bi-level, or whatever the case may be. But to think that she's really truly committed to making sure that the patient has great airway patency, and then using other tools to help the patient essentially become adherent to their CPAP therapy. So I'm super intrigued by this myofunctional therapy. It also scares me to death because it feels like there's a lot of work and a significant commitment by the patient to stay engaged in the therapy process.
I think one of the things that we don't think about as techs, and I really don't know that much of sleep medicine thinks about, is nasal breathing.
Right.
And, one of the things that we didn't really get into is the value of nitric oxide. I mean, the nasal passage naturally produces that. That's a vasodilator. And so here we are much of the time focusing on the collapsed airway, not really thinking about the value of trying to teach that patient to breathe through their nose and succeed with that because of its other value related to their wellness and health, particularly what nitric oxide does for the nasal breathing patients. So I think what she's doing with myofunctional therapy is incredible. I hope that we can learn more about that, and maybe even bring more guests on that we can expound on.
Before we go, we would like to thank our sponsor, Medbridge Healthcare. Medbridge Healthcare is developing innovative inpatient, post-discharge, and population health programs to screen comorbid conditions, diagnose and treat sleep disorders. Learn more about their innovative solutions and career opportunities at medbridgehealthcare.com. Once again, you can learn more about their innovative solutions and career opportunities at medbridgehealthcare.com.
Sounds good, man. And well, gents, appreciate you all, and we appreciate the folks out there. Until next time.